So Dr. Conrad, can you tell me a little bit about the differences of these implants?
Sure. We have shaped implants and we have round implants. The round implants and the shaped implants, for that matter, all come with a different base diameter or width of the implant. And then the implant has a certain amount of projection, a certain amount of height relative to that width. For instance, in this hand I have a high profile implant, and in this hand I have a moderate profile implant. And I think you can see that there's a little difference in the shape of it. And this would be tailored to the patient's width of her breast and the shape of her chest. The shaped implants come in all different sizes and shapes as well. We have here an oval-based implant. As you can see, the back of it is fairly oval. In contrast, this implant has a much different footprint. It's called a classic profile, and they each have different amounts of projection depending on how much filler material is in it and the design of the implant. These would be tailored to the different shape of the woman's breast or her chest shape or something like that. Interestingly, these shaped implants have a different surface texturing to them, and it's kind of, if you touch it, it's kind of rough, in contrast to these smooth implants, which are typically to the round implants, which are typically smooth. And this texturing or this roughness allows the implant to be held in place by the soft tissue that surrounds it, because you would not want this implant to spin or turn upside down, whereas with a round implant, it's inconsequential. If it moves, it's not a big deal at all. In fact, we kind of want it to spin. So there's a little bit of differences between the shaped and the round implants just demonstrated there.
Now, how would you determine which implant is right for the patient? Is it their preference, or is it something that you determine?
That's a great question. I think it's a combination of the anatomy that they bring with them. In other words, it's sort of like getting fitted for gloves. You know, there's only a certain size glove that really fits that hand the best, and that's probably the case with a breast implant as well. There may be a little more fudge factor with a breast implant in that you could put in maybe more volume with potentially some adverse consequences, but in general it's going to be based on their anatomy and the dimensions of their breasts, and then also their desires and their goals to some degree for cup size and things like that.